Okay. Hello, my name is Victoria, and I will be your nurse assessing you today. Can you please tell me your name and age?
Jason Chogish, 30.
All right, Jason. So I can tell that Jason is alert and oriented times 3. Speech is clear and audible. Expression is smiling, and patient is in a pleasant mood. No overall deformities noted. Personal hygiene. It's well groomed. Nutritional status is appropriate, and it appears well nourished. So we're going to move on to your head, and I'm going to inspect your head, and I'm just going to feel around if that's all right.
Okay.
So I'm inspecting and feeling. I don't know any lesions. So I'm going to next. Can I have you stick out your tongue and clench your jaw? Thank you. So that shows me that cranial nerve 5 and 7 are intact. Next, I'm going to palpate for the sinuses. And can you tell me if there's any pressure or pain?
No. No.
Okay. So next, I'm going to move on to, and I just inspected your overall skin, and everything appears normal at first. Hair is well distributed. Skin is nice and pink. No obvious deformities. I'm going to move on to your eyes.
Okay.
I note that your eyebrows the hair is well distributed, as well as your eyelashes. I also note that your eyes are equal bilaterally on your face. Sclera are nice and white. I have a brown iris. I'm going to check your conjunctiva, which are pink and moist. So we're going to move on to assessing it with my pen light here. So I'm going to have you look straight at the pen light, if you could.
Okay.
I'm going to shine a bright, straight at me, sorry. And I'm
Oh,
going to shine
okay.
a light in your eye.
All right.
And then I'm going to shine it in this eye.
Okay.
And I note consensual pupillary reflex. Pupils are equal, round, and reactive to light and accommodation. Next, I'm going to check your 6 fields of vision. And 6 vision fields. Can I have you follow my finger without moving your head, just your eyes? All right, and that extraocular, that test for extraocular function, and that appears to be intact as well. Next, for purposes of the video, I do not have a Snellen chart, so a normal person would stand 20 feet away from the chart and be able to read 20, or a normal person would be able to read 20.
Okay.
So that was that. And then next I would move to your nose, which I'm looking midline and inspecting. I don't notice any lesions or deformities. I'm going to test patency of each nair, so I'm going to plug one each side of your nostril. Any difficulty breathing?
No.
And then I'm going to test this nostril. Any difficulty breathing?
No.
Okay, perfect. Then we're going to move on to your mouth. So can I have you open your mouth, and I see teeth are white. Can I have you say ah?
Ah.
Uvula is a 2+ and rises and falls. Tonsils are a 2, or uvula rises and falls and is midline, and tonsils are a 2+. Teeth are nice and white. Mucous membranes are pink and moist. Everything looks good there. So next I'm going to move on down to your neck, and I'm inspecting your neck. I don't notice any deformities, and you get good hair distribution of your beard. We're going to check for range of motion now on your head and neck. So
Okay.
if I could have you push against my hands up, like shrug your shoulders. All right, and then can I have you turn your head this way and turn your head to the other side and backwards and forwards. Range of motion appears intact with the head, or with the head and neck. Next, I'm going to palpate your, preauricular, postauricular, occipital, posterior cervical chain, anterior cervical chain, tonsillar, submandibular, submental, and supraclavicular. So those are your lymph nodes. I palpated your lymph nodes.
Okay.
And then next I'm going to palpate your carotid artery, which I know is a 2+. And I palpated both carotid arteries bilaterally. They're both a 2+. Next I'm going to feel for midline for your trachea, which appears midline as well. So next I'm going to have you, I'm going to look at your posterior chest, if I could have you turn this way.
Okay.
So I'm inspecting your posterior chest, and I don't know anything out of the ordinary, no unlabored breathing. I'm going to test for that your chest rises and falls equally. Can I have you take a deep breath? All right, and chest rises and falls equally. Next, I'm going to test for tactile fremitus. If I could have you take a deep breath. And say 99.
Huh?
99. Say the words 99 every time I touch your chest.
Okay.
Just say 99.
99.
Just keep saying 99.
99. 99. 99. 99. 99. 99. 99.
Tympani is noticed the greatest between scapula. So next I'm going to percuss. So I'm just going to tap. Tell me if there's any pain.
Nope. 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 Nope.
All right, and then I'm going to check. And I'm going to check for CBA tenderness. So I'm going to have you feel a bit firm thud. If there's any pain, please let me know.
Nope. Nope.
All right, and that tests for the kidneys. Next I'm going to auscultate your breath sounds. Can you take a deep breath? And breath sounds are clear to auscultation. I'm going to be moving to the front of you, and I'm looking at your chest. I don't notice any obvious deformities. No obvious deformities, and I don't know any, and breathing is still equal and unlabored. So I'm going to listen to the front side of your chest as well. And can you take a deep breath? Making sure to listen to right lateral. And breath sounds are clear to auscultation. So next I'm going to find your apical pulse, which is the 5th midclavicular line intercostal. I'm feeling the apical pulse. I don't notice any heaves or thrills, no extra palpations. And I'm going to listen to your heart as well. I'm going to start with the aortic. And then pulmonic, which at both aortic and pulmonic, I notice that the S2 sound is louder than the S1. And then your Erb's point. And then tricuspid, S1 is louder than S2. And mitral valve, which S1 is louder than S2. All right, and then I didn't notice any So we're going to move now to, we're going to check out, can I have you put your arms out? I'm going to inspect your hands. I noticed that your capillary refill is less than 3 seconds, which means that you have good blood flow. I'm checking radial pulses, which are both a 2+. And like I already said, on inspection, there are no extra deformities. Hands are pink and warm. I may have you do some range of motion for me. So if I could have you stick your arms out in front of you, and then to the sides, and then above your head, and all the way down. Thank you. All right, and then for this next portion, I am going to have you lay flat on your back for me, if you could.
Okay.
And if you could just lift up a little bit of your shirt. All right, so I am inspecting the belly. It is nice and flat and soft. No extra pulsations noted. I'm going to next listen in each quadrant. And on auscultation, all vowel sounds are present and normal active. Next, I'm going to listen over the aorta for a bruit, which no swishing is heard. So next, I'm going to percuss the abdomen. So all right, and then next I'm going to, general tympany, little dullness noted up on the right side upper quadrant. Over the liver, I'm going to next do palpation, light palpation, so tell me if this hurts.
No. No.
All right, and then next I'm going to move to deep palpation, so.
No. No.
Okay. And then for this next part, I'm going to start looking at your legs, and kind of have you take those socks off for me, please.
Okay.
All right, so I'm assessing pulses here. I've got a dorsalis pedis, that's about a 2+, and I'm moving to posterior tibialis, which is also a 2+. So I'm going to have you do some range of motion for me. So
Okay.
I'm going to have you move your leg all the way up to your chest for me. And then your other leg. And then can I have you bring your hip and leg out and in, which shows one at a time.
No, one at a time? Okay.
Which shows abduction and adduction. Then next I'm going to test your cerebellar function for me. So if I could have you, first we'll test our light reflexes. So I'm going to touch you, and I'm going to have you close your eyes, and I'd like you to tell me just which side and which body part I'm touching.
Okay.
So.
My left cheek, my right leg, left leg, my right cheek, left arm, right arm, right shin, left shin.
All right, and so superficial touch is intact. I'm going to next test. I'm going to start testing for your cerebellar function now. So if I could have you stick your arms out and flip them back and forth as rapidly as you can. So that's supination and pronation, which is intact. Then supination, pronation. My other cerebellar function. Oh, can I have you please stick your, on the opposite leg, can I have you stick your heel to your shin, or your knee, and go all the way down your shin. And then again with the opposite leg. Again, that tests for cerebellar function, and that is intact. Next, we're going to be moving to reflexes, and if I had a reflex, work, I would be doing this. Can I have you just stick both of your arms out like this? And I would be hitting here and appreciating a reflex in the fingers, and then hitting here and appreciating a reflex in the fingers. Next, I would test patellar. So I would be hitting here and noting a reflex in the foot, and noting here and noting a reflex in the foot. Then I would do Achilles down here and hitting this, and I would appreciate a reflex and appreciate a reflex. Then next I would be checking your foot for a Babinski sign, which I would start here and go around. If it were positive, I would notice fanning of the toes or any extra movement, which I don't. Again, I'm testing here, which no flaring of the toes, which is a good sign. That's what we would like. So next I'm going to have you get up and walk for me.
Okay.
Can I have you walk just down the room? Gait is even. Can I have you walk back, heel to your toe, and heel to your toe? So balance and musculoskeletal are intact and appropriate. That's good right there.
Okay.
Next I'm going to test, we're going to do something called the Romberg's test. And I'm going to have you stand right there and then close your eyes and stick your arms out all the way to the side. Alright, and then can I have you lift your knee up for me? And that is appropriate. I don't notice any extra swaying, and balance is appropriate. And can I have you bend all the way down in half? So can I have you bend over with your spine and go right and then turn right to left? All right, and can I have you stand back up?
Okay.
All right, thank you so much for coming in today. Your balance and range of motion are intact.
You're welcome.